Welcome back. We have Ken House and Chris Loftis with us, and they're from CMC Hospice. Welcome to the show.
Thank you.
The CMC Hospice, tell us a little bit about it.
CMC Hospice is one of several hospice companies in the area. Kind of like other healthcare providers, you can choose who you want to treat you, and CMC Hospice is one of the hospice companies in the area.
Okay. Is it for a fee, or is there different ways to pay for that?
Well, actually, hospice is a program that's a benefit to most people. Actually, we've never billed anybody for any services, so families don't get billed for anything. It's a Medicare program, also covered by Medicaid and insurance too.
That's very important because a lot of people out there don't, end of life or get in that situation. Yeah. They're limited on their funds. So
exactly.
So you're here in Mountain Home. Also, we're going to be talking about National Hospice Month. Is that for every hospice, or is it just for CMC?
That is for every hospice. The month of November is when we celebrate and speak about and bring up the benefits of hospice and how that, since it's such an underutilized service, and as Ken mentioned, there's zero out of pocket, no matter what your situation is, even if you're medically indigent and you don't have any type of insurance or payer source.
Yeah.
So just bring up the benefits of hospice, the fact that we have social workers on staff, chaplains on staff, volunteers, and it's not so much that it is pain management for the patient themselves, but the fact that hospice, one of the best benefits of hospice is that hospice does not end when the life of the patient ends.
Right.
For 13 months after that, we follow that patient's family, and when they're able to access some bereavement support and things like that.
Now, is there going to be an event happen throughout the month? Are you going to participate in any kind of awareness
we signed several proclamations with mayors around our service area, which is 50 miles from Calico Rock. That's where our certificate of need is based. So we cover everything from Ash Flat to Harrison, down to Clinton, Batesville, Heber Springs, and then up to the Missouri border. So we're trying to get just awareness out about the program and that people should utilize it when they're in that situation.
Okay.
Well, what is the situation? Because once upon a time, it's been quite a while back, I was visiting with someone who's affiliated with a hospice organization, and I was under the completely false assumption that hospice was for people dying of cancer. But it's for all, so when do I call you?
You can really, a person can be referred to hospice anytime that they've received any kind of terminal diagnosis.
Okay.
If it's a terminal situation, whether it be heart disease, it can be cancer, it can be respiratory disease.
Well, once I get that terminal.
Yeah, exactly. That's kind of that's really the point in time when hospice can be brought on board for someone to help. We always kind of distinguish. And it's a big education piece for people to understand this. There's curative medicine, and curative medicine is that kind of medicine we're all used to, where you're going to get better. And then there's palliative medicine, and palliative medicine is to make someone comfortable, as a stage somewhere in their disease process. As you go along during that palliative period, hospice can be a part of your treatment anywhere along that line. So hospice really it's part of the continuum of care. It's a continuum of care, and it doesn't matter for us, as far as hospice is concerned, where a person lives, as long as they have a home. I tell people all the time, I don't care if you stay at the Holiday Inn Express. As long as you're at home there, that's where we can treat you. If you're in a nursing home, if you're in an assisted living facility, if you're at home, as a matter of fact, statistics show us in surveys, 80% of people really want to stay at home during their last months of life. We make that possible. We can't cure cancer, we can't cure heart disease, we can't cure the other kinds of things that end people's lives, but we can make life much more comfortable and much more beneficial for them and their families if we have an opportunity to serve them.
Do you find that people wait too long sometimes?
Yes. Yeah, that's
should contact you.
Really one of the sad parts about things is, and it's an education piece not only for patients but also for physicians and other health care professionals, is that the earlier that we have an opportunity to treat the symptoms of a patient, the better quality of life they have, and actually the longer they live with a higher quality of life, because we make them comfortable. I said we can't cure these diseases, but we can certainly treat them and make them more comfortable as life progresses.
And what are some of the things your volunteers do for them?
Oh my gracious, volunteers are wonderful. Volunteers do everything from...
Yeah, I know they're the backbone.
Yeah, they're the backbone of things. I mean, the volunteers will sit with patients and allow their family some time to go out and do things that need to be done. They will just provide them the friendship and the kind of collegial benefits that they need. They help us in the office. They send out mail outs. They just do wonderful things for us. The volunteers are great.
I've heard cases of people that go into hospice, and it's such a great experience for them that they get better and they don't need hospice anymore. Is that a situation that happens?
About 4% of all patients will graduate from hospice or get to a point where they no longer meet hospice criteria.
Yeah.
We have several sister home care agencies around our service area. We actually have 4 that we use and send people back to, so that they have kind of a stable, transition.
Can you list those 4?
Yes, North Arkansas Home Care here in Mountain Home,
Okay.
North Arkansas Home Care in Salem, North Arkansas Home Care in Batesville. We have CMC Home Health in Calico Rock, and just opened a new Elite Home Care in Harrison that will be coming on board as a sister agency.
All right. I'm aware of those people, yeah.
Is there a national hospice organization?
Oh, yeah.
Okay.
Yeah.
So everybody, different hospice organizations, they all belong to that?
Yeah, like any kind of national association, any kind of major healthcare operation. There are national associations. We have a state association of hospice and palliative care organization. We just had our conference probably 45, 60 days ago. But it's clearly a strong voice in the healthcare community.
Okay. Well, if I receive a terminal diagnosis and I call you, what's the first step?
First step is that, to call. We then do an assessment. We get your medical records. We make sure that a terminal diagnosis is actually been given to the patient. And from there, we start assigning nurses and clinical social workers, and the chaplain is assigned, and if a patient and family needs that. And from that point forward, we have a plan of care. That plan of care talks about how often that patient's seen, what kind of treatment takes place. Everything is individualized to the patient and to their family of what they need and what they want.
And you said 18 months after the patient's gone, you deal with, or 13 months, you deal with the family?
That's correct.
Is there a process of education along the way to help the family better care for that patient too?
Yeah, there is a process of teaching the family how to better care of their loved ones and the proper steps to take, when to call us, when they need to go straight to the emergency room, when to make those decisions. Because hospice in a whole, for the most part, keeps those hospital admissions down. And we teach that family and educate them about the warning signs of this and that, and the process of dying, which is individualized and not always the same, but there are some things that are common.
For those people out there interested in what you guys do and want more information, how can they do that?
They can call us at 870-424-4000 and get information. There's obviously no obligation to get information. We can mail them some information. We can drop by and see them. Chris particularly calls on our physicians and all of the other healthcare professionals in the area and let them know what we have available to us. And like I said, this is National Hospice Month, so we really want to do all that we can to educate people and let them know what hospice is about and what kind of benefit it is to them. And it truly is a benefit, and like we said, at no cost to a family.
Okay, all right. Well, the number's been on the screen there. You can give them a call, Ken House or Chris Loftis from CMC. Thank you so much for being here. Appreciate you guys, and hope it's a great month for you.
Thanks.
Thank you. Up next, we're going to turn the page here and talk with Kim Croshaner from the Donald W. Reynolds Library. She's going to be talking about Tim Ernst. Stay with us.